Okay.
All right, thank you for being with us on our Facebook Live today. I'm Cassandra Wallace with ThedaCare Public Relations. I'm joined by Dr. Mindy Frimodig in our Shawano location, but you're serving all the areas around Shawano County. Dr. Mindy, we thank you today for being with us, answering questions. We really want this to be a community conversation. So we are asking anybody watching to leave your questions, your comments down below, and I will be monitoring those, getting to as many as possible and asking Dr. Mindy for that information. So again, we really want this to be an opportunity for you to ask those COVID-19 questions about influenza, what we're experiencing in Wisconsin and in the communities here around us. Again, really want this to be an opportunity for people to ask questions. This is your time with Dr. Mindy. And again, Dr. Mindy, we appreciate you being with us today. So let's get started with sort of an update. What are we seeing in Northeast and Central Wisconsin when it comes to COVID-19?
I think a lot of people follow the numbers themselves. They go on the county webpage, the health department, or the state webpage. I think people have probably seen, but we're still hitting record-breaking numbers of cases. Yesterday again was another record, highest number of cases we've seen. I think it was just under 8,000 in a 24-hour period, and 52 more deaths, bringing the total to almost 3,000 for the state of Wisconsin. I think the more concerning thing that we see with the numbers, though, is not just the total number, but the trajectory of the numbers and how fast they're changing. Just as an example, so in the last 18 days, there have been as many cases as there were in the first 231 days of this pandemic. And already in the last 18 days, we've had more cases than we had for the whole month of October, when it was already pretty bad. The hospital, go ahead, sorry.
Yep, so exactly what you're saying. I mean, we are seeing record-breaking numbers nearly on a daily basis when it comes to hospitalization rates, positive cases, and it doesn't seem to be slowing down at any rate, correct?
Mm-mm. No, our hospital's been at capacity really for the last 6 weeks here in Shawano. More than 50% of our census has been with COVID patients, which gets really taxing on the staff. Not taxing, but it's difficult. We have had to, unfortunately, early October, we had to close surgeries for the hospital here because we had so many staff, including nursing, that were out sick or quarantined, that we weren't able to staff the main hospital unit without doing that. So we did close surgery. Any surgeries other than emergent surgeries were transferred to other hospitals. From what I understand, we are going to be able to open up on the 30th of this month the surgeries again, which is really good. There have been some new opportunities or beds that have become available for people needing discharged after a COVID infection or admission, which has helped with that. I think some of the nursing homes have started setting up dedicated units for patients who are not ready to go home yet, but don't need the high level of care that a hospital offers. And so that, I think, is opening up some beds, which is a blessing because we'll be able to keep more people locally.
Yeah,
We've had to transfer as far as Kenosha when there was no bed availability locally.
Can you talk a little bit about that? We keep hearing so much about capacity and numbers, but it's not necessarily about how many beds are open, really. It's about the team members who can care for the patients in those beds. So can you kind of talk just a bit about how that, team members, again, just maybe being out or exposed to the virus, how that impacts the care that can be provided?
That has been a big issue, actually. Our capacity for admissions has actually been limited more by being able to staff the beds in many cases than by actually physically having the beds or the spaces. When this all started and we were doing all the planning, we actually have plans that would allow us to triple capacity in most of the hospitals, at least here in Shawano. But realize as the numbers really picked up, staffing is a limiting factor to that. And a big part of that is people being out sick, often with COVID on quarantine from a family member with it. I think at one point we've had about 100, we've been averaging about 170 team members throughout the system, not just in Shawano, but throughout the system that have been out on any given day. A third of that is nursing staff, which makes it really difficult to care for our patients then.
Can you tell us a little bit about what it's been like for the team members? And it affects all of our hospitals and all of our locations, Shawano included, but what has it been like over the last couple of months as we have been experiencing this surge? What is it like for our team members?
I think it's been exhausting, frustrating, heartbreaking, I think, in a lot of cases. I feel for our nursing staff in particular, they've really been stretched thin and are doing an amazing job. But they have in many cases been the front line and taken a lot of the brunt of frustrations of people, often on the phones. They're getting yelled at sometimes because, when initially early on, when testing was more limited or access to appointments was more limited, people would get very frustrated with them. That was really hard on them. In the hospital, it's been really difficult for the nurses. I think, I'm speaking with somebody yesterday. One factor that seems a little different with this than other conditions potentially is when somebody is admitted for COVID, typically it's COVID pneumonia or respiratory distress. It's not a quick admission. They're in for a long time, 10, 12 days, sometimes longer than that. And so you really get to know the patients. Unfortunately, they're in the hospital by themselves as well, without visitors being able to go in. So you see their cards and their flowers from loved ones, and you really get to know them. And a lot of these patients, seeing how they're doing, it's not going to go well, and that gets really emotionally difficult. The nurses, the doctors, everybody.
Yeah, we appreciate all that you and the team members in Shawano and all of our hospitals and, just healthcare in general. We appreciate all that you and those team members are doing, because you're right. It is absolutely something that they've never experienced, caring for those patients. So we appreciate that. Dr. Mindy, we are getting some questions coming in here from those that are watching. So again, we want people to comment. Please leave your comments. That's Dr. Mindy is volunteering her time here to answer some of these questions. I have a question from Nancy. She's asking, are you noticing younger people getting COVID? Again, at the beginning, we sort of heard that this was something that impacted older adults, but are you experiencing younger people with them contracting COVID?
Yeah, definitely. I mean, there's actually, I think probably some of the highest rates of infection have been in younger people, not necessarily little kids, but young adults. Not the highest percent of severely ill patients. Generally, the people who get more sick with this, what we call severe COVID, generally are going to be older patients or higher risk people. But definitely seen an increase in younger adults, which unfortunately they think is probably a big part of why it's spreading so much in communities, because they don't get particularly sick with it all the time. It may feel like just a cold and don't think much of it. And so they go about daily routine and it ends up being spread to people who are higher risk.
Yep, that was going to be another one of my questions for you, how asymptomatic people are contributing to the spread that we're seeing right now. Can you talk just a little bit about those who may have symptoms that they're sort of disregarding and what that has the potential to do?
Well, I think that's one of the biggest issues with COVID-19 or the infection from SARS-CoV-2 versus something like SARS-CoV-1, which was the MERS initially, is that people are they're most infectious in the 2 to 3 days before they even have symptoms. Through somewhere between 5 to 7 days is their most infectious time. They can remain infectious beyond that, but it's those 2 to 3 days before they have any symptoms that they're most likely to spread this and most infectious, which is different than some other viral infections. And that's the difficult thing, is people are often, they're not knowingly spreading this. They're not doing it on purpose. They don't have symptoms yet, which is why masking and social distancing is so important to get this under control, because people don't know, they don't know they're sick. They don't know they're infected.
That brings us to another point here. Let's jump into masking. This has been a topic that we've heard so much about over the last couple of months. Again, we know the science behind this. We know that masks play a significant role in the fight against this virus. Can you tell us again what community members should be doing, when they should be masking, and just the general guidelines around masking?
Masking has been a really a politically driven topic from the beginning, unfortunately. And I think a lot of that is because there were inconsistencies in the initial recommendations from what the science is now showing us. Initially, I think they had come out at the national level and said, don't people in the public shouldn't be masking. And I think some of that was probably misguided recommendations. I think maybe to avoid the run on masks like there was on toilet paper, to make sure that there was enough PPE and including masks for healthcare workers and first responders and places where they were absolutely needed. And I think there just had not been enough science or studies done on it yet. At this point, the evidence is really unequivocal. I mean, even through the summer, they had said, well, they probably help, but the CDC just recently, I think just this last week, finally released an update and a report saying, without question, masks make a difference in slowing the spread of this. Initially there was also guidance that really the mask probably, it helped others around you. It helped you from infecting others around you, didn't play as much of a role in protecting yourself. They're also finding that that's not true either at this point, that really it offers protection for those around you as well as yourself, which is really an important point. Masking can be a standard surgical mask, like you see in hospitals, but the CDC even supports and has found in their studies benefit of a simple cloth mask. So I think their general guidelines are a 2-layer, 100% cotton woven mask has really been shown to decrease the spread of this. So I've heard a lot of people throughout this time say, well, at some point we have to get this. We have to we'll build immunity to this. We're just gonna not wear it so we can get it. And it actually, what they're finding, there's emerging evidence showing that there's a correlation between the amount of virus you're exposed to, or the inoculum, and the severity of illness. In some cases, that may not be true in somebody who is immunosuppressed or immunocompromised. But overall, they find that if there's a higher amount of viral particles you're exposed to, you're more likely to get more sick with it. And so wearing a mask they're not 100%. So it doesn't prevent you from getting infected necessarily. But if you are with somebody who's infected, the amount of the virus you are exposed to will be significantly less because of the masks. And I think you have a graphic you're going to show. So this graphic is really, I found very helpful to explain this. You can see from the top down, where neither one has a mask on, the risk of transmission is very high if somebody is infected. And that would include in the pre-symptomatic phase. I mean, they make it look like this person's coughing potentially, but this can be just something simple as talking, singing. There's still droplets coming out, being spread. Down to the next, where the person who's not infected has their mask on, you can follow it down. I mean, the most benefit is when both people are masked and there's that physical distance of, they say, 6 feet. It makes a big difference.
Thank you for going through that. Again, I know that, masking has been talked about sort of since this pandemic started. So I always think it's good just to get some factual information about the science that we know. Again, getting some questions coming in here too as well. So we want people to engage. Again, this is your time with Dr. Mindy. Please take advantage of it. Dr. Mindy, I do have a question from Jamie, and it sounds like some family members tested positive for the virus and others didn't. Do you have any thoughts about why some family members would contract COVID-19 and others may not test positive?
It's hard. There are reasons, and it's hard to say whether they were not truly infected or the test was not accurate or the test was done not within the right, and I should say not within the right time frame, but the time frame was not optimal for getting a positive test. So to some extent, it depends on the test that was done. The newer test that we have available, which is the rapid antigen test, it's the nasal one, so just in the front of the nose versus the, as I call it, the brain picker, the nasopharyngeal one. The antigen test is very good, but it's not as accurate in an asymptomatic state, and it's not as accurate beyond about 7 to 8 days because that viral load is starting to go down. So it's possible that somebody, when they were tested, if they were negative, yet in close contact with somebody who was positive, it may be that they were outside of that window when the test was optimal. I would say that's probably the best explanation. Most of the tests that we're doing, both the PCR, which is the deeper nasopharyngeal one, and the antigen test are really quite sensitive, but depending on where in the illness, you can see a false negative.
Okay, good information to keep in mind there about why we might be seeing some family members test positive and others who may not. I think that also probably brings us to the point about quarantine, isolation, and guidelines that we really should be following when it comes to being exposed to the virus. Can you talk just a little bit about that? Again, I know every situation is a bit different, and it's, kind of depends on when you're exposed, the contact that you have, but can you tell us a little bit about quarantine and isolation and why it's so important that you follow those guidelines?
Yeah. Before I go on, I want to real quick come back to one thing with the testing, because this is a key point that one of my partners shared with me that's working in our respiratory hub clinic. Now that we're able to offer the rapid test, so it's a 15-minute turnaround time, and it's the nasal one again, so it's slightly more comfortable. One of the issues that they've seen is people getting a little frustrated because they come in at day, say, 8 to 10 of having symptoms, and they have to have the deeper nasopharyngeal swab. So that really is an important point to get across. I think if you are wanting to be tested or need to be tested, should be tested, getting in within that first week of symptoms, especially for the rapid test, is really important. They can still do the PCR test after that 7-day mark, but people aren't always wanting that one. So I just want to point that out. So the quarantine and isolation, these are probably words that so many people have never really thought much about, and now we're inundated with them. So the difference, isolation is going to be when somebody is sick and needing to isolate away from people to not spread it. Quarantine is essentially a healthy person who is exposed, not being out in the public so that they're not potentially spreading this. The recommendation for isolation is 10 days from a positive test or from the first day of symptoms, depending on the clinical picture, until they come out of isolation. And that isolation is really recommended in your home. And by that, it means not really going anywhere. If you live in a house with other people, really trying to isolate even from those people within your home, whether that's to a different level of the house or a different room, wearing masks in the house. In that case, using a separate bathroom, ideal if that's an option. So that's really important, because it may be that the people that you're living with, maybe they haven't been infected with this by you. So that's why that isolation is so important. After that 10th day, they're finding that people are probably no longer significantly infectious. Now, some of the tests, like the PCR, that deeper one, nasal one or nasopharyngeal one, can still come back positive up to 3 to 4 weeks sometimes, but they don't feel like those people are infectious or still spreading the virus. In some cases where somebody may be immunosuppressed or immunocompromised, they often are recommended to isolate for up to 20 days because their immune system is not as able to fight it. And so they remain infectious for somewhat longer. Same with somebody who's hospitalized with more severe infection. The quarantine gets a little bit more confusing. The guidelines say 14 days of quarantine beyond from the date of last exposure to the person who was infected, which is a little more clear-cut if it was somebody outside of your household that you were closely exposed to for that 14 days. When it's within a household, it can be pretty long because it's 14 days from the end of their infectious period, which is the 10 days. So this can be, I mean, it can be almost a month sometimes of quarantine, depending on how much somebody is able to isolate away from somebody who's sick.
Okay, good guidelines for us to keep in mind, but you're right. I mean, these are just sort of different situations for each family or person who does test positive, because again, like you said, if you're a parent and you cannot separate yourself from a child that you're providing care for, your exposure, I mean, is completely different than somebody who would not have that potential.
Which is why it's so important to cooperate with public health. They really are the ones that offer the guidance on this and can really help you figure out how to do this the safest and best way. And, you know, unfortunately, that's one of the problems that we're running into here and in places around the country, is people not wanting to cooperate with public health. They, you know, they see their phone number on caller ID, they won't answer, they won't call them back when public health does reach them, and they need to do the contact tracing, meaning finding out who they have been with when they were potentially infectious, where they've been. They're not telling them. And that really has contributed to a lot of spread in the community when we're not getting that information out to let people know they have been potentially exposed.
So cooperating with public health is just absolutely imperative here.
It really is important. And I mean, with the numbers where they are, I mean, public health really doesn't have the capacity in some regards to be able to do the contact tracing with everybody anyways. So even just speaking with public health so they can inform you of what you need to do and what that, I mean, they would then tell you, please let everybody you've been in contact with in this time period, let them know this information. But if people aren't answering the phone to talk to them, it's difficult to get that information out.
Okay, good for us to keep in mind there. Again, getting a few comments here. We want those comments to come in. Again, Dr. Mindy is going to address everything that we can possibly get to today. Dr. Mindy, we have a question from Nicole, who is wondering a bit about antibodies. We've heard a lot about that recently as well. So she's asking, you know, can you tell us a little bit more about antibodies? And if you do test positive and you do have those antibodies, you can potentially donate plasma, correct, to help with treatment of others. So can you just discuss that just a bit?
Yeah, you know, the antibody testing has been, I know it's controversial, is not the right word, but you don't hear about it as much because it's really not used to diagnose an active infection. Antibodies are the protein that the body builds up essentially to fight an infection naturally. And depending on what it's targeted at, it can be in the body forever, or it can be in for a short time. It can be in small amounts or large amounts. But it doesn't generally develop until 3 to 4 weeks from infection. And so it's not something that we widely test to make the diagnosis. Where it's being used generally is in people who have had a confirmed infection and want to donate plasma And so we can do the antibody testing then to see if they do in fact have antibodies. We've had some people who have clinically very much seemed like they had COVID, but their test was negative, and we've done antibody testing down the road. And in some cases have seen it was positive, and in other cases it wasn't. And so the hard thing is that we don't know if that means that they never really had it, or if they just didn't mount enough of an immune response to build up any persistent antibodies.
All right, lots of talk about antibodies. You've heard that again over the last couple of months. We have some more questions coming in here. Let's keep on this theme of testing. I have Jean who is wondering about saliva tests. So, I haven't heard so much about saliva testing. Okay, good. So
I honestly, I don't know that much about it. I know it's being studied. We're not doing it here. I'm not sure, and I apologize for not knowing. I think that may be what this new home testing that was just released yesterday. I think that may be the saliva testing. From my understanding, it's fairly accurate from what I had read. But like I said, we're not doing it here yet. And I think it was just yesterday that the announcement came out about the new home testing being an option. So I think there'll be more to come about that in the coming weeks.
Okay, good to know. Again, taking our questions live here. I am monitoring comments, trying to get to everybody that we possibly can. So please leave your comments for Dr. Mindy. Let's go to a question from Trisha. She's asking about guidelines for families who may have a child who has come in contact with another student who tested positive. What does that really mean for the family of that student who has come into contact? Should that entire family be quarantining? Does it sort of vary upon the situation? I think we're also hearing a lot about that too. So can you kind of address the situation?
I think to some extent it depends on the situation somewhat and how extensive the exposure was to the other student. So including the distancing that was there and masking. Technically, the public health guidelines say that sounds confusing, but an exposure to an exposure does not need to quarantine. With a child, it's a little bit different depending on the age of the child, because they probably need an adult there with them anyways. But technically, by the letter of the law, you would not need to quarantine if you were exposed to somebody who was exposed, but not having symptoms or had a positive test.
Yep, exactly what we talked about. Those quarantine and isolation guidelines can be a bit confusing. So I know that the CDC has some really good resources on their website too, where it sort of takes apart some of the scenarios and situations and then gives you recommendations. ThedaCare has community hotlines that you can call. We have a website dedicated to our COVID-19 resources. So again, lots of places out there where you can get that information, or maybe even calling your primary care provider again, just to check in, see what those recommendations are and help you follow those guidelines.
Yeah. And that's where those situations are where masking really is so important, because every situation is not the same and it's not definite. And so, even in that case, public health might say you don't need to quarantine unless your child becomes positive. But there's those scenarios where they are going to become positive and now you've been with them. And so really wearing a mask out in public, especially, really is so important. And I don't want to beat a dead horse with the topic of masking, but because it's been so controversial, it's something that we need to just keep coming back to. And I think, often I've heard people say, well, I don't wear a mask because I'm not high risk. And so I'm not really worried if I get this, I'm fine with that. So I'm not going to wear a mask because I'm not high risk. And I get that. But the issue that we're seeing, so many of these patients that, that are hospitalized, especially the more severe patients, we've asked some of them and, were you masking, were you taking precautions? And many of them were, because they were often high risk. And so they were taking precautions, they were wearing masks, they were washing their hands, but they still had to do things like grocery shop and other parts of daily life that they had to do. And when the most effectiveness, like that graphic had shown, of masks is when both parties or everybody in contact wears them. So by wearing a mask, you are not only protecting yourself, but you are protecting those around you, even if they have a mask on, because they're not 100%. They can still get infected when they have a mask on, but they will get much less if you are also masked. So it really is important.
Right. It's not always just about protecting yourself. It's about protecting the others around you.
Yep.
Okay, so I have a question here from James. This is really interesting. It sort of goes along with people who everybody experiences. If you have a positive test, everybody experiences this differently. There's no like, if you get a positive test, this is what you're going to experience, and here are your symptoms. You know, he is referencing a family member, it looks like, that had a positive COVID case, an older person, 97, he says, and did not have a single symptom. So can you kind of just tell us that there is no cut and dry formula in this, and it affects everybody differently?
And that has really been the hardest thing, is it is unpredictable. I mean, the numbers would say that the older people, older somebody is, the higher their risk of complications. But I've had patients in their 90s who have had this, and they've done okay. I mean, they've been a little sick, but they've gotten through it. But we've had patients in their 30s and 40s and 20s who have been really, really sick with this, and they may not have necessarily had risk factors. I mean, we know diabetes about doubles your risk of complications from this, but so that can be anybody, any age. But even young, healthy people can get infected with this. And oftentimes the really, I don't know, scary is not the right word, but eye-opening thing that we're seeing is people who have been infected potentially with just mild illness, they have found damage to the lungs, to the heart, even after that. And so this isn't, even if you have mild illness, it doesn't necessarily mean that you're out of the woods with this. So it really is in everybody's best interest to try to not get this.
Oh, that's such a good point. We don't, I mean, everything is so new, it's changing rapidly. We don't know what the future implications of a positive test are going to be. You may feel fine right now, but we just don't know what the long-term effects could potentially be.
Yeah, I mean, completely honestly, when this all started, and myself, I said, let's just get this over with. I'm healthy, I'm not high risk. I just want to get it, be done, hopefully have immunity and move forward. Thankfully, I have not gotten it. And in all honesty, everybody I've seen with this, younger people, I don't really want to get it. I don't. I mean, even these younger people who have not progressed to a point of needing to be hospitalized, they're really sick. I mean, they feel really, they're horribly fatigued. They have horrible headaches. Probably the most concerning symptom to me that I hear about is this brain fog that people talk about having for, sometimes 4 to 6 weeks after infection, if not longer. Just feeling like their thought process is slow, it's difficult to focus and concentrate. And I'm not scared of this. I don't think anybody should live in fear. That's not healthy. But it just means taking the precautions to try to not get it if you can help it. A lot of people reference, when they look at the numbers, they reference the number of people who are recovered, and it is a large number, and that's really good, but that doesn't actually take into account the people who are developing what they're calling now this long COVID or post-COVID syndrome, and they're finding it's probably about 10% of people that are developing this, to the point they're setting up clinics around the country now to do more research on this and to help take care of these patients.
Yeah, absolutely interesting. Like we've talked about, this is just all changing and developing so quickly that we just, we're going to be studying the long-term effects for this, it sounds like, for quite some time. We're going to get to a few more topics here. Dr. Mindy, I know we also wanted to cover, what we're asking the community to do. I think Thanksgiving and the holidays are sort of on everyone's mind. So we'll get to that topic as well. We have more comments coming in, trying to get to those as well. Can we talk just a little bit about other types of care? So much focus has been on COVID, and we also don't want the community to be deferring care when they need it, coming in for heart attack, stroke, mental health and behavioral health services. There are so many options when it comes to virtual visits to address those issues. Dr. Mindy, I know that you've talked about this before. We don't want what we're experiencing right now with COVID to impact, a future of behavioral health or mental health issues. So how do we kind of keep that in the back of our mind, even though all this talk is about COVID and this virus?
Yeah. That has been one of the most unfortunate parts of this pandemic, I think, has been all the secondary effects. I mean, the effects of COVID are horrible enough. I mean, almost 250,000 people that have died from it. That's horrific. But that's just from COVID. I mean, there are other downstream effects that we're seeing, and we're seeing cancer diagnoses, the number of heart attacks, the number of strokes, they've all gone down, which at first glance might sound like, oh, that's good, but nothing has really changed in our healthcare lifestyles that would decrease these. It just means that people are not coming in for care for these things, which is really unfortunate. What we're seeing and what we're going to continue to see is later stage diagnoses of cancer, which is not good because it decreases the treatment success and treatment options. People not coming in for their heart attacks, which can be dangerous and deadly sometimes. Same with strokes. And so, early on, systems were closing clinics as far as routine visits because of decreased access to PPE, so the personal protective equipment, masks and such. And really, I think across the country, the downside of that was seen. And so health systems are making a very intentional effort of not letting that happen again. We are working very hard to make sure we're getting these people in for the care they need. The message that we need to get out is don't be afraid to get that care. It's a lot of people say they haven't come in because they're worried about being exposed to COVID. They don't want to go to the emergency room because they're worried about being exposed. They don't want to go to the clinic for that reason. Don't let that be a deterrent to seeking care that you need. We are all wearing full protective equipment at this point. And actually in Shawano, we're all wearing N95s, the even higher grade masks. Patients all have to mask when they come in. Don't avoid coming in. The emergency room, we're seeing the numbers in the emergency room are less, but the acuity or the sickness of the patients is increasing, which is because they're unfortunately deferring coming in until they get really sick, which is really not optimal. The risks of, another concern is the increased risk of rates of depression, substance abuse, and even suicide. That's horrible. And it is a consequence of the pandemic. But the hard part has been that those particular topics end up being an argument used to discount the management of COVID. And we can't do that. It does not have to be an either or. They're finding that nearly 20% of people who have had COVID are reporting depression, anxiety, and insomnia. And 5 to 6% of those are new first-time diagnosis. So this isn't something that they just relapse with because they got sick. And so mental health issues are a real issue of COVID, not just the effects of shutdowns and isolation. And it's not to minimize it, but there needs to be a different way to address those things, not to just act like COVID isn't real.
Absolutely. Good points to bring up there, Dr. Mindy. We also, you see a lot of different patients in Shawano in those areas. We also don't want the preventative care to stop as well. The wellness visits, the immunizations that kids need, the flu vaccines that we should all be getting right now. Can you just kind of remind us about why that type of care is also important right now?
Yeah, that's really huge. And again, that unfortunately was, those were the visits that were often getting deferred back in the early days of this. And we're really, really trying to not continue to do that. We're making sure that people can come in for those visits. If people really are concerned about their risk of exposure, they can do a virtual visit, whether that's over a video or a Zoom like this, or a telephone visit, an e-visit, which is just directly over the computer. There are lots of different ways that we can do that. And again, we have, everybody is wearing masks in the clinic, so the risk of exposure there is going to be much less. The risk of not getting your well care, having your pap smear done or your breast exam or your mammogram is, again, those consequences I just talked about. Those, we're missing things. We're missing potentially an early breast cancer that would have been very treatable, or a heart murmur that, would have, clued us into a heart problem that was coming, or so it really is important to come in, or at least be in contact with your doctor for those routine visits. And if you really feel like you are too high risk to come in, please just call and talk to your doctor or your provider just to explain that to them. And if you have questions, we can figure out how to help you.
Absolutely. Keeping those lines of communication open, very important right now. Again,
Yeah.
taking questions from those who are watching. Please keep the comments and the questions coming. Again, your time with Dr. Mindy here. I'm asking those questions as we can. I have a question here from Wanda, who says she's visiting her father and they're outside very often. So should they be masking even if they are 6 feet apart? Again, we did that this summer because, it was nice outside. People were outside. They weren't necessarily masking because they were outdoors. We're seeing more people move indoors because of the cold weather. So what should people be doing as they are interacting with loved ones, trying to stay as safe as possible?
So this summer, I would say when we were interacting with people outside, we generally didn't wear masks this summer when we were outside. We weren't in large gatherings, but if we were with one other family, we'd be outside and we would keep our distance, but we didn't really worry too much about it. But again, our numbers were not that significantly high here at that point. Our percent positivity here in Shawano is over 50% now for the last, I think almost the last month. It's been really high. And unfortunately, it's becoming that way all over the country, even down in Florida. The numbers are really increasing. So I think especially if you are with somebody who is higher risk, I think there's no harm in wearing a mask. I think that's the biggest point to take home is, could it be overkill to wear a mask outside if you can keep your distance? Yeah, maybe, but did it really hurt to wear it? No, it didn't. And so I think if you can do anything to, especially with our older patients and family members, they need socialization. They need to see their family. They've been isolated for too long. And if we can do anything to try to do that safely, do that more safely, I think it's worth doing. I get questions about, can I hug my grandparents? Can I hug my grandkids? And that just breaks my heart when I have patients tell me they haven't hugged their grandkids in 6 months. It's awful. And so I think so much of this is just common sense and taking the precautions that we can take. I'll tell them, no, you can hug your grandkids, but make sure you guys have masks on. Try and not have your faces right next to each other when you do it. Try and, duck down and hug that way if you need to. Hug somebody. My grandpa, he was leaving for Florida recently. By the way, I think that's my mom who asked that question.
And we love it when family members are commenting. That's wonderful.
I gave him a big hug from the backside, around his back. Don't not hug people. Just do it safely.
Absolutely. Can we expand on that a little bit about, at first it was social distance, but people kind of took that, the physical distancing and then took it as social distancing, that I'm not, I kind of lose contact with people. I'm sort of shutting myself away from others. That's not at all what we're asking, correct? There are so many other ways to stay connected. So can you just talk about the importance of socialization, like you talked about in older populations, but just for all of us?
Yeah, I think there's just been this dichotomy that's been formed throughout this whole time, that it's all or nothing. It's either you're out footloose and fancy free, hugging and seeing everybody, or you're at home by yourself for 7 months. And neither one of those is healthy, and neither one of them is necessary or right. So it's just really finding this balance, because socialization it's necessary. I mean, I'm an extrovert. I need people. I need to be able to talk to people and see people. And so, in the summer, it was easier because you could do this outside, which was definitely safer. We know the risk of this infection spreading is significantly higher in indoor settings or indoor gatherings. So summer made it easy because you could do this outdoors. Winter is going to be a little more difficult up here. I mean, they pick up, skiing and sledding as your new hobby and do outdoor activities, but it's still going to be more difficult. And so I think a big factor is just to limit your contacts then. I mean, so, social distancing is not just it's keeping the physical distance, but it's also minimizing any contacts at any one given time. So, around Europe, they had sort of started, and it's here, this idea of having a bubble. So your group of maybe 5 to 10 people, one other family that you trust is also taking the same precautions. They'll tell you if they have any symptoms whatsoever. You're comfortable wearing masks with each other in the house. I think that's really important to do. But one of the biggest areas of spread that we're seeing has been in these small gatherings, or indoor gatherings, I guess I should say, and large gatherings. And that, with Thanksgiving coming up, and then Christmas, poses a real concern.
Yeah. Let's jump into that, Dr. Mindy. Again, I think that's so much what people are talking about right now, the holidays that are coming up. The CDC has come out and said that large gatherings are just not recommended, especially for here in, Wisconsin, where we're seeing record-breaking cases every single day. So let's talk about Thanksgiving, what the recommendations are. What are some other alternatives to a traditional Thanksgiving like we know? And then just going into the holidays, what can we expect? Things are going to be different. How does mental health play into that? Again, I know I'm giving you a wide range of topics here, but let's start off with, our holiday next week and Thanksgiving and what we should be doing.
So Thanksgiving, and it is one of my favorite holidays, usually. I don't want to quote Dr. Fauci, I don't want to be the Grinch who stole Thanksgiving, but I think this is not the year to make this your biggest, best Thanksgiving celebration. Ideally, to decrease the spread of this and slow this down, you're keeping it to your family or one other household. And again, trying to follow those precautions like we talked about, not being around a whole bunch of people right beforehand. I think there are certainly ways to do this with your family, maybe one or two, sisters and brothers. So again, we talked about, being outside is really the safest. That's really probably not an option here. Maybe it'll be really unseasonably warm next Thursday. We can all hope. And the reason inside is an issue is because of the air exchange. It's just, there's not enough air exchange in a typical setting. So there are things you can do, like put an increase air filter in the house. You can open all the windows in the house on that day, have a heater going because it might be really cold, but open all the windows to keep the air moving through. Wear masks in the house, which again, might seem odd when you are in your own house, but wear masks in the house. And when if you have more than one family there, that's you're all going to be eating at the same time, set up separate card tables around different areas of the room or the house so that you're 6 to 10 feet apart. Take your masks off to eat, drink, and then when you're done eating, put your mask back on and talk that way. There's no need to restrict socialization if you can do it safely. I also think it's not unreasonable to ask, if next Thursday, you're going to have your brother and sister and their families over, make a pact that you're all going to try and relatively quarantine as much as you can between now and then. We have testing that's much more readily available in the communities now. Go get tested on Monday. So it's not a guarantee, it's not a given that if you test negative Monday that you're not carrying it asymptomatically or pre-symptomatically, but it at least gives you a little bit more of a sense of safety or security going into that day. And if you are positive, well, then you know you really shouldn't be there. So I think that would be a really good idea. I've seen, some tips, and reading up on this, just some ideas, things like, for instance, in your bathroom, like put paper towels in the bathroom and not a hand towel that everybody that comes through is using. Have separate serving spoons. If you're going to have, all the fixins put out, everybody gets their own serving spoon, so you're not sharing the same serving spoon. I think if you are going to do it, there are ways to do it a little more safely. I had seen a ad this morning for Zoom, and it said, so Zoom apparently is, and I'm not trying to do an ad for Zoom, but apparently they are allowing for unrestricted time period on Thanksgiving Day for this reason. And the ad had said, host a Zoom Thanksgiving so you don't have an ICU Christmas. And it just gave me goosebumps when I read that, because it really should be food for thought. I mean, this is the exact time frame of the way this disease tends to work is if somebody, a grandparent, an older aunt or uncle, somebody who's high risk is infected on Thanksgiving, they very well may be in the hospital come Christmas time. So it's not to not celebrate Thanksgiving, it's to just be mindful of it and do it as safe as possible. And, if we can really quiet things down here locally by doing those, maybe Christmas will be a little better. We won't have to worry as much.
All right, good recommendations there. We're coming up on our 1 o'clock hour here, so we have just a few minutes left on our Facebook Live. Again, taking comments. We will be monitoring these comments after our Facebook Live ends, and we'll try to get to as many comments as we possibly can from there. Dr. Mindy, we've covered a lot of topics during this hour. One thing I just want to talk to you about is you've been a physician for a long time. You've been in our Shawano community for a long time. How has this impacted you? And what have you noticed in the community? And what do you want from our community members?
That's hard. It has had a huge impact, I think, on myself and like everybody, but my partners as well. I think it has been difficult. I think the divide that has developed often because of this pandemic and the politicization of it has been difficult. People have trusted us, and they trust us to take care of their heart attacks and their cancers and deliver their babies and fix their broken leg, but then question our judgment when we say wear masks, keep some distance, please get in and be tested, this is real. That's been difficult. I also think practicing in a small town, our patients, we do hospital medicine and the clinic medicine here. And so our patients we take care of in the hospital they've often been our patients for our whole careers. And when they don't do well, it's really hard. And not that we have not been there with patients when they've near end of life, but this has just been a very different toll, I think, in that regard. So to the community, I think the ask would be wear a mask, and not to, again, there's that horse, sorry. I'll leave it at that. Wear a mask, please. Just wear a mask. Keep that social distance, but please still socialize. You still need to see people. You still need to be with people. Get a really warm coat for this winter so you can meet outside in the park. Keep in touch with family and friends. Don't become that isolated that you lose touch with them. Please keep supporting our local economy. I mean, that's been a really big downside of this pandemic, right? Has been the economic impact. And that initial shutdown, that was really hard for businesses and awful. And so I would never advocate to not support our businesses because of this. We really need to do that. Our main street downtown, it needs the support of our people. It needs us to go spend our money there. But we just need to do it safely. And so when you go do your Christmas shopping, wear your mask when you go out. If you're sick, please don't go out. Don't assume that your slight cough and runny nose is allergies. Probably isn't this time of year. Don't assume that. Just stay home until you feel better and then go do your shopping. Support our local restaurants. Do carry out. Do, you know, if you go into a restaurant, wear your mask until it's time to eat, and then put it back on. When the server, waiter, waitress comes to the table, put your mask back on. Don't share anything with them. Don't jeopardize their job. They're working really hard to get through this, and they need the support of everybody in this community just as much as everybody else. So please continue to support our local economy. And last, get your flu shot. Please get your flu shot this year. You know, so flu shot really doesn't have any bearing on COVID itself. But when flu season comes, our hospitals fill up anyways. When we're dealing with both, come the height of flu season and COVID's not going away yet, it's going to be a huge tax on our system. Please get your flu shot this year. You know, masking is actually going to decrease our flu levels, I think. And I think this really is not the flu. I know there are some people who say, well, you know, this is no different than the flu. The numbers would really argue that it is very different. I mean, Wisconsin in 2019, 2020 had 36,000 cases of flu, 4,400 hospitalizations, and 183 deaths. With COVID, we've already had 312,000 cases, 14,000 hospitalizations, and 2,600 deaths. It's not the same. When all is said and done and we have a COVID vaccine, it may very well end up being much less severe than flu. Flu is not as severe because we have a flu vaccine. So I'm really, really hoping, and I'm optimistic that the results from the COVID vaccines that have been released recently are really, they're hopeful. But the key when you hear that news and read that is they will not be readily available to everybody anytime soon. I mean, I know they say they'll be released late in the year, early in the new year, but that if it is the case, it will be really to high risk people. It won't be to the general public. So we cannot let our foot off the pedal on these precautions. Please keep doing the safety measures. You know, I had heard a quote with the other day with regard to the vaccine that essentially said, giving up on the safety measures, the masking, the distancing, all that right now would be like sending the whole infantry to the front line unarmed the day before the surrender was coming. Don't do it. With the vaccine on the horizon, that's really hopeful and reassuring. But if we can, anything we can do to not lose more people until then, let's do.
All right, Dr. Mindy, I think that's where we should leave it there. Good recommendations, again, good guidelines. Thank you so much for taking the time to answer so many of our questions and just address the topics that I think we're all kind of thinking about right now. Thank you very, very much, Dr. Mindy, and thank you all for joining us today.
Thank you.